So we're working with Tai Yang and or Shao Yang patterns, lumbar pain and hip pain. We have the needles in the hand. I'm probably going to do 2, Yao Tong Xue, and then 22.07. I've got shoulder points in to address the hip. Okay, I don't put the shoulder points in unless there's a hip condition, but I know those shoulder points are going to work through the back functional line to reach into the glutes and GB30 area. Now, when I bring my hands like this and I start to do gentle traction and pull, that's a nice way to start because that's keeping the movement within the bladder meridian and the superficial front line. So I'm working the anterior and posterior lines when I do this. My hands are on the anterior lines and the superficial front line. By doing this and providing gentle traction, it's working into the superficial back line, right? So this is my anterior, posterior manual therapy that is helping to release that tension in the low back and the hip. The traction is also going to pull on the femur a bit to help open up the space and the joint space in the pelvis, okay? And at the hip joint. Now, the next move that I'm going to do after this is just to move her leg over into a lateral position because this opens up the gallbladder line. Now, I'm likely going to do some gallbladder points because she's got pain here, and this is that System 6 method. But by doing this, I can palpate this whole line before I actually put the needle in. So what I can do is I can anchor with my hand here, okay, and just hold it, and then I'm just going to apply gentle pressure. It's a stretch as well, so I'm combining acupressure and stretching. I like to start with the palm, just so that I don't go in too quick to any points and aggravate her. She's maybe in a very relaxed state right now, and if I go in and start pressing with my thumb, I might find something that sends her off the table, and then guess what? She's not so relaxed anymore. I want to create comfort and ease and parasympathetic response, right? So this is helping to do that as well. I can press up higher in, and I can ask her to give me feedback in terms of sensitivity. And does that feel any better? You know, just a question like that, right? Check in with them. And a lot of times they report that the pain is better. It's improved already with those first group of needles. Okay, so palpate up and down the line just with your palm to start. Here I start to get into the joint space. After you've used the palm, then you're going to go back and you can use your thumb. Okay? I've got access to thigh 3 springs. I can palpate through that area. I've got access to the IT band. So I'm going to find where the tension's at. I'm going to just palpate up and down the line with my thumb now. And you can even reach back up into the GB30 area and get direct pressure through the glutes. Okay, now I think of this as just more of a warm-up and a way to initially explore where the tension's at, because what I want to do is I can do another group of needles to finish. So far, I've only done 4 needles, maybe a few more. I could do 2 in the hand and 2 in the shoulder for some people. For non-responders or people with bigger body types, I might do 5 needles, 3 in the deltoid and then 2 in the hand. So I have her in this position, and then I've palpated the line. I'm also going to palpate this line as well, where we can palpate the peroneus longus. Okay, I can put her back in this position. I got direct access to the head of the fibula. I can do Ton's GB34 point into the tendon there if I want. I've got access to the lateral 3 passes. I can just palpate that whole line